Oh, he needs. Oh, they missed my fantastic introduction. Oh,
You set? Okay. Um, Thank you, Chair. I wanted to talk a little bit about some of the movement. I think we've talked a little bit here about SHS reform and some of the work that was happening over the summer. Excuse me. Particularly with the idea, while it was driven by should we go to the ballot or not, there were some good things that were highlighted in the engagement that Metro did, and I just wanted to uplift that work is moving forward. Metro yesterday, Metro Council had a presentation from staff to really look at what do they need to do over the next few months and what are opportunities for reforms that we could make. It's things like not just the governance, but I think the KPIs and having regional key performance indicators was a big component of that work. And I think we'll talk more today about our KPIs, but there's a lot of alignment that I see there because it's really that focus of how do we move towards a system at a regional level. I just wanted to, we're all in this tough budget. I think we've heard from Home Forward, from Health Share. We've talked about it at the county, at the city. State reductions, federal cuts are all really impacting what we're able to do here. And so it requires us to have really a system where what we built today is a patchwork based on just where funding might come. Like when the feds wanted to end veterans homelessness and we saw a huge increase in vouchers, we shockingly were able to end veterans homelessness and reach functional zero. So those are the sorts of things that is how we build our system. And this gives us an opportunity to look at it, I think, a little more broadly. Um, they will have a series of work sessions that will result in a work plan in the end of November. So council dates, just if folks want to be tuned in, are October 30th, November 6th, and November 20th to talk about some of the potential reforms. I think particularly the governance structure is a big piece that we've heard about. So we should see more from them on what that ordinance will look like. And additionally, I wanted to uplift, because I'm not sure if we did, that staff did a great job of hearing the call to get done the data sharing agreement. And so that is actually done and on the path of being able to look at this from a regional level. I also wanted to highlight the conversation around spending with SHS, that 75% of the dollars are slated to be for population A, which is a more broad definition of chronically homeless, and population B, which looks a little bit more like a lot of what our eviction prevention, some rapid rehousing work. Multnomah County has continued to spend above the required amount on population A, and I think that it just begs us to have a regional conversation about resource allocation. We have a higher number of folks experiencing chronic homelessness. Our resource doesn't yet match the need, and so that's something that I think is still a pending reform conversation to come. And I just, this for me today, and I want to appreciate Jillian, all the work that you've done to get and your team to kind of get us here with a lot of different feedback on these KPIs. I just think it's an opportunity for us to move forward together in this. And again, it's in so much alignment with Metro in the region that I think it'll be important for us to share, continue to share back with this group as Metro's work moves forward, since SHS is such a critical funding source for our system. So thank you for a few minutes to share that.
thank you, Commissioner. Mayor Wilson, are you ready to go?
Thank you, Jillian. Good morning, everybody. I really want, and I always often start with a level set on why we're meeting and a call to action. So it was a week ago, my team sent me a video of a person who was found dead on the Portland streets downtown. And during the morning, we had hundreds of people walking by that person, driving by and such. And so I just really want everybody to focus on that call to action. I always want to begin with that, the calls I get in the morning on our citizens. And then to address that, we are now at the final stages of what's called a person down. So our 5 public safety service areas are going to be required if somebody's lying in distress, incapacitated in Portland, which has become normalized. If they are going back to the barn from a call, they're going to be required to stop. And so we're going to start emulating what we want to really provide to the community for those that are suffering in Portland. Some things that I do want to talk about on the positive side is I had a meeting with the hospital networks in Vancouver on Monday about hospital dumping in particular, and how cease and desists have been sent out. Now they're on notice that if it occurs, they will be sued. We will move to lawsuit, really trying to address the inflow into the Portland metro market, or I should say the Multnomah County market, that they are required to apply a plan. We want them just to apply the plan and making sure that Portland isn't a destination. We really have to address and follow our rules. As far as celebrations and shelter announcement, 180 new family shelter beds announced this week, 3 new facilities with 100 vouchers. We will be announcing at or around 400 new units next week, bringing Portland up to about 1,230 units on our goal to 1,500 by December 1st. So we're really moving forward to surge up and to flex up for the winter months that we can feel it getting cold. We're really excited about that. Housing. We housed 40 people around the nation in October with their loved ones. Yesterday, we had a disabled person from BHRC connected and flying home today to meet their mother. Really having success. That $10,000 saved us in this community $12 million in housing costs if it were a $300,000 per unit or per door. And when you think in terms of what a mobile housing team worker, the expectation to house, it's about 20 people per year. Our 2 reunification experts are housing 20 people per month with a goal to move that up to 100 people per month right now. So really excited about that. And then on November 1st, there's a last item. We are beginning the citations to arrests on and or in encampments and removals. And so we're really wanting to help those individuals into care. We don't want to be citing people, but if there are illegal activity at an encampment, we will be citations. I've been working with our justice system. Our goal is to reduce and remove that, help people into recovery and or care or whatever that next step is on their journey. If there are warrants, we will be checking for that, and those arrests will be processed at that time, really to really take that pressure off of that and those that are suffering on the street. So thank you so much for that. Thank you, Jillian.
Thank you. Thank you, Mayor. So thank you both for those announcements. I did want to just talk about a couple of housekeeping items that I neglected to. We have some of our community advisory members joining us today, so I want to thank them for taking the time to be here and joining with us. Thank you guys for taking the time. It's really important that we have the cross communication for all the different groups, so thank you for all the work that you're doing. I wanted to just reiterate that what we're hoping to do today is to really take the work that's been happening since May in the conversations with community partners, with the implementation committee or community advisory committee to update and revise the plans. And what we're hoping to do today is to really wrap up that development work and move it forward to option. So after each discussion today, the voting members of the group will decide on whether or not to refer these items to each governing body to consider. So we're hoping to have 2 votes at this meeting. I know that one of our elected officials, voting members, Mayor Stovall, wasn't able to be here today. But we will move forward as best we can with those.
Yeah.
And with that, I will turn it over to Jillian to lead us into our first topic.
Thank you, Chair. Next slide, Maggie, if you could start it again, please. And 2 things on our agenda today, right? The action plan and the KPIs. I'm going to tighten mine up and go brief to make up the time here. Next slide, please, Maggie. Thank you. And by the way, I should pause to say Mindy is online right now, so she is listening in. We just cannot see her. Okay. All right. I'm going to take very little time to talk about the updated plan to preserve most of the time for conversation, and then also the key performance indicators part of our morning together. So I'm just going to share enough for members of the general public and media to bring them along. So by way of reminder for those tuning in, the Homelessness Response Action Plan and current set of performance indicators were developed during calendar year 2023 and then passed by the County Board and Portland City Council during the summer of 2024. Immediately after passage, a team was put in place to establish the oversight structure, our 3 governing bodies, and to begin work on the deliverables as outlined in the action plan. So for again, to the benefit of those online, in an attempt to be clear about what this plan is and is not. So the action plan represents all of the systems and programs we should be looking at regardless of the level of homelessness in our community. Some of it has really big financial implications, like our work to expand our shelter system, fund more permanent supportive housing units, rapid rehousing initiatives. Other work represents really big systems level work, such as creating ways to connect housing and healthcare systems to improve outcomes for those we serve, or policy lifts like changing city code to make it easier and cheaper to build housing. So it's a variety of work. What it is not is an overarching investment strategy, right? That is primarily driven by our key performance indicators and your budget votes. So we consider them, while they are very much connected, the strategies feed up to the key performance indicators and any program goals or whatnot. But really, it is the budget process that drives that investment strategy. And of course, we'll be happy to weigh in on our opinions on that in the fiscal year 27 budget cycle. So with some solid work accomplished over the past year, it became clear that we were already due for a refresh. And with the new nationally respected work of the data team at the County Homeless Services Department, there was an opportunity to reorganize the action plan with how we talk about the homelessness response system and the big buckets of work. So in May, we set out to engage all of our invested partners internally and externally. And what you have today is that reorganized and updated plan. In your packet, I just want to highlight that top page. There is a letter from our Community Advisory Committee who is deeply involved, and they have written that letter of support for both the work product of the action plan and then also the direction we're heading on the key performance indicators. Next slide. So again, this is the first time this plan received a refresh. It won't be the last. We have always planned that this document adapt and keep up with the work that needs to be done. Before you is sort of a mix of existing items being carried forward. Hang on, my computer sorry, it's blacking out on me. Existing action items refined to be more clear, and then new action items that represent the work ahead. And I just want to say truly that thank you, Ryan, the collaboration, let me get to the right slide. Over the last several months has been incredible. I really do think that we have some rockstar staff at the city, at the county, at Metro, all really leaning in and doing the hard work in the face of a monumental shared task before us. And this plan, what I just love that it gives us a guide. It keeps us on track. It keeps us on task internally and externally. And I'm just energized to keep moving forward on it. So next slide, Maggie, just some nuts and bolts. You'll recall that the original plan had 9 broad goal areas with an appendix of a mix of things. It was really hard for people to follow along. So we've now reorganized it into 5 goal areas. 3 of those goal areas align with how we talk about the system, right? Simply inflow, safety off and on the streets, and outflow. The 4th is care coordination and cross-sector collaboration, because it is deserving of its own section, because that is a huge body of work, big lifts in healthcare, behavioral healthcare, and of course, the intersection with housing. And then finally, the never ending, as it should be, need for data and evaluation, especially actionable data analysis, and how it allows us to always be in that state of continual improvement, which is the goal of that section. Next slide. And then we just provided a little map for how to read the plan. I'm just going to note 2 things on here for folks in the room and at home. We added that status column, so y'all and everybody else who cares actually knows which things are underway, the conversations that are happening, and what we are looking at doing next. If you have an opinion on the doing next part, for sure, we welcome that. If something's really important to you and you're not seeing that reflected here, that can be part of your feedback. And then I just want to note the responsible parties. It is just sort of the main conveners or leaders or funders. It's not exhaustive. It's subject to change as conversations take shape, but we just wanted to give you a flavor there. It was impossible to capture it all. And then for conversations with the state of Oregon, because I know I'm going to get this question, for if there are active conversations, they were listed. But once I have your approval, I'm going to sit down with them, walk them through top to bottom. They're going to have their own spreadsheets so they know exactly where we need them to plug in. So that will happen. I'm going to leave it at there. I was going to take time to sort of go through and highlight some things in the plan. I'm going to skip that part and just go to discussion. Maggie, if you could move it to the next slide, to just make up the time. So we are doing a lot of stuff. Do y'all agree it's the right stuff? If not, what's missing and what would you like us to prioritize if not already noted? So feel free to just jump in there. The chair and I will work together to make sure that everybody is seen and heard. And Maggie, will you tell us if Mindy raises her hand, please? Thank you. Was that too fast? Commissioner Singleton.
Thank you. It wasn't too fast.
Okay.
I think one thing that came up to me looking at it was number 2 in workforce. Just a question if there's, it would be awesome to look at how we can explore public-private partnership. How can the business community show up around workforce goals? And I know that Peter's not able to join us today, but I'd love to explore opportunities to pull businesses into being a part of the solution. I feel like folks want to do something and they don't know the what. And I've had some good conversations with people at the workforce table that Commissioner Jones-Dixon and I had, but we started with the trades and that's not the only option. So what else can we kind of pull in to that part of the conversation?
And in response to that, just very quickly, the table we pulled together to develop the next set of workforce action items, because all of them are new, were all the contracted partners of via work systems, which is a little bit different than your group. So we should connect those two, but they brought up this soft ask. And I asked them just generally, like, what are your conversations with Prosper or Biz Oregon? And I think there's been some fits and starts to that, but certainly they are interested in more employers who are willing to employ this population. So yeah, we need to work on that.
I just had a question. So I really appreciated having the letter from the Community Advisory Committee. I know that the implementation committee had a chance to review these in previous meetings and had any feedback. Is there any updates from them in terms of what we're seeing today?
Chris Neal should be here. Jordan is out of town, but they were both involved and brought along. The implementation committee had, let's just say, several bites at the apple. And so I think they were active participants in it. But we did not get anything organized out of them. Like the CAC is just really good at organizing and weighing in. So credit to them.
And Chair, the piece that I would add to that is because of the implementation structure where we have those senior bureaucratic leadership from each of those city departments, county departments, city bureaus, we were able to get really clear direction to engage with their staff that are at the ground level doing this exact work. So what you see reflected in most of these action items is really clear interaction with the folks who are really in the weeds of it and who are able to shape it.
I think I want to talk more in a global view. First of all, Jillian,
Mhm.
this is a huge undertaking and a lot of work. So looking at HRAP 2024 versus this one, or 1.0 and 2.0, some of the things that I think I saw and or I used at the previous one, you all know I'm a kind of a dog with a bone. Tell me what the number is, and I want to hit the number. And the discrete core goals from the last HRAP on page 2 were very succinct. It was like 6 key goals. We're going to reduce unsheltered homelessness 2,699 souls. Number 2, we're going to add 40% more shelter capacity. Those are discrete goals. I didn't get a chance to read through the whole thing. Forgive me. And I know we've been immersed in it. And so the numbers are all good and the measures are all fine. My concern is that those discrete goals, the measurables that we put up on a board and we talk about every single meeting, and then we collectively agree to hit those. I hope we can pull something out in the iteration that goes forward in the next month or in the 12 months. It helps me manage what Portland can do to assist the collaboration so we can focus on that shared goal. You know, I'm going to be supportive of this, all of it. But I just want us to focus on the word that you mentioned earlier, continuous improvement. Once we sign or agree, I want to just know that the hard work begins, it doesn't end. And I hope we can pull out those discrete, hard outcome expectations to then address the activity as we go in.
Yeah, and Mayor, thank you for that, because I should have been more clear. It's not that things in 1.0 disappear, right? Everything still exists. And one thing you mentioned is a KPI. That specific KPI will go away with the adoption of new KPIs, and we've exceeded that one. Number 2 is the shelter goal that's still in play. So it doesn't go away just because we didn't lift up every bit of text out of 1.0.
Yeah. Thank you.
And I think that, I mean, we are having 2 conversations today, right? So this is the action plan. And I really look at this as what are we as the entities that may be designated, you know, as responsible for these different action plans, like need to be looking at and doing? What do we need to be advocating for those partners that we don't have direct control over? What do our folks here from housing, from healthcare, right, need to be doing? How can we come together and advocate for things at the state? Our next conversation is going to be around those key performance indicators. And I think that, Mayor, is where we can see those very concrete goals that we are going to be striving for through this work that's delineated in the action plan.
I tried to not take up a bunch of time the first time, so I'll jump back in with the rest of my, oh, sorry, go ahead, Eric.
So are we gonna go through each one?
I did not know, and I was gonna highlight some, but we're skipping over that given the late start, so.
Thank you, Counselor. A couple of pieces that I wanted to add. One, I don't necessarily think that, I do think it's important that we flag where the state has some responsibility, and I think we've missed some of that in a couple of these, which I've shared back.
Yep.
But I wanted to say that in this room, where we don't have control over resource, it's just important to name that. It doesn't mean we have, to the chair's point, the ability to control how they budget, but their budget clearly impacts what we do if we look at the reductions on rent assistance, for example.
Yep.
The other is something that I heard, I think when we were in Atlanta, Mayor, was the intentional focus on 0 to 30% units. It feels like an important piece to call out in this plan because we've talked about affordable housing, and the general public does not understand that affordable housing is mostly serving workforce. What we're talking about is the deeply affordable for ending homelessness work, and our pipeline of 0 to 30 is really, really low. Our bonds were able to do more, but we still didn't get us there. And so I think it's important to name so that we focus on the housing that actually will serve this population, particularly when so much of the focus is around chronic homelessness. Thanks.
We will have lots of questions for Director Historick, who is here, and we'll be talking about that in the next section.
I'm going to go to Zimmerman, Statlander, and Matthews.
Thanks, Chair. So I think that in the last iteration, the by name list was an important thing that we've been able to implement, right? I think now the next piece of that to make that by name list helpful is, now that Eric Zimmerman is on the list, what is not what are the many, but what is the most important factor to his homelessness? And I think being able to categorize people to have an understanding for what it is we're really dealing with remains missing for me, unless it is in there and I've missed it, because we talk kind of in generalities about this much goes to chronic, about this much goes to emergency, about this much, et cetera, et cetera, et cetera. But there is an individual aspect that I think the by name list gives us an opportunity to get very specific, that I find incredibly important, because if you're tackling a problem and you can't say what that individual's problem is, you're probably tackling in the wrong direction. And it doesn't say that there aren't multiple factors, but I think for most people that I've encountered and most folks I've talked to is like, there is the one thing that kind of begins the cascade into the many things. So the many things are addressed in here, right? We've got some criminal record stuff in here. We've got some treatment stuff here, but what is the one thing that started it or remains like the biggest hurdle? If we can find a way to categorize that on the by name list in a helpful way, I'd be very favorable to that. I think that Commissioner Singleton brings up an interesting point that I also want to continue to talk about, which is perhaps there's a different term we use for when we say the deeply affordable, the lower than 30%. At the end of the day, really what we're talking about are folks who are unlikely to, in the near term or perhaps ever, have the ability to afford their own homes. And that's okay for us to talk about. There is a group of our population who is going to need to be system, society, government supported. And that's a factor. Because I think that misconception about who's using affordable housing is, it's important to dig into that. You know, and some of the stuff that the city is looking at and the way we're talking, the reason I'm supporting it is because I admit that there are some people in our community who will never afford whatever the number of the rent is. And so let's get over trying to say that everybody has to afford some level of rent. There are some people who are just sick enough or in need of our help enough. And I think it's a small percentage. If you get people healthy, the group who can never take care of themselves is small, but we should start talking about that more clearly. So underlining Commissioner Singleton's point there, I have always valued our programs that are considered the emergency interventions. You know, the person whose family kicks them out and we can nip that quickly. The medical bill that is now competing with, like those types of emergency rent assistance or placements, et cetera. I am concerned that we don't have enough data to dig into a person who's been placed in housing and then they are out of that housing. It's permanent supportive housing. And again, they're remain chronically homeless because whatever reason they failed. I would like to be able to understand that more. And for me, it gets to the inflow outflow piece. If we can put more money at preventing the inflow for those who haven't gotten into the system yet. And my hypothesis is that a lot of money is going at the chronic folks who are failing out of permanent supportive housing and then back into it. And we're doing this cycle. And perhaps we could be doing more at the upfront for those who haven't fallen into that most dangerous situation. So for me, the chronic homeless population and its use of the system dollars is, I'm not sure yet with this document how to responsibly allocate resources if I think, because I can't tell exactly where we're spending. And the less kind way of saying it is like, are there people who we could put money at who would be successful very easily and very quickly? And are we letting them fall into it because we're putting a lot of money at people who continue to fail, continue to cycle, continue to fail, continue to cycle? And what pressure is that putting on the system? I'd like to understand more about that as we go into what this IGA looks like in the future. And then lastly, I would really like to best understand in the system we have created over the last 10 years, who is it most working for, right? Who is successful? And if we can say this person, this type of situation, this demographic seems to be successful in our program, that allows me to then move brain cells to other topics or to review what's successful and spend some time in segmenting populations to get a better understanding. But what I haven't really seen is who are we most successful with and for and how and why. That's it. Thanks.
Thank you. And Counselor, I had a question. So when you were talking about like not knowing where dollars are being spent now, like I think that one of the goals of doing this work is so that as we're considering our next year's budget, we think like these are the things that we need to be doing. Is it helpful to maybe look at the city budget, the county budget, metro, et cetera, and see maybe where we are allocating dollars? we've done a little bit at the county, to Commissioner Singleton's point of like, we are actually, we overspend in population A, but so I don't, if that's something that maybe we could ask, staff
Yeah.
to look at.
So thank you for the question. I left out part of why I wanted to bring up. So I think y'all remember when we had our joint office, or excuse me, our joint county city meeting. And I brought it up again with our government relations as we at the city craft our next legislative agenda. But I'm really starting to beat the drum that my favorite day would be for the city and the county to go on camera and take our legislative agenda, rip it up, and put one thing there, which is that we need a serious conversation about a mental health hospital north region that is not accessible by the judicial system. The reason I say that so heavily is that my estimation is that we are spending a significant amount of money on people who we probably, no matter how much money we spend, we aren't equipped to deal with their needs because they have been failed by a system that based this only in community-based mental health resources. And we're not able to, well, frankly, I think it's inhumane and disrespectful in the way that that system is being utilized, right? For most families and most people who fall into severe mental illness, it's going untreated, particularly if you're on the streets. And unless you commit a crime, you don't get access to the Oregon State Hospital. So it is related to that, because knowing where we're spending these dollars, and I say that as the city, right? We don't have social workers on our payroll, but it is interrelated. And I think it makes the case of, look at what Multnomah County, Metro, Portland, everybody is spending on this population that at the end of the day probably needs to be served by a state system that has continually failed and has not been reinvested in. I think it helps us make our case, because if they were to take that on and throw $1 billion at it and nothing else, it would hurt in the short term for some of our legislative priorities, and it would, I think, benefit us in the long term that one of the greatest problems has state attention again. So that's where I'm bringing it up.
Yeah, thank you.
And the spending that we do, it's like, yes, that's the best we have to spend on it, but we might not have the best tool, no matter how sharp it is.
Yeah. No, thank you so much, Council. I appreciate that. So I have Statlander, Matthews, and Suarez. Mindy?
Thanks. Yeah, thanks so much, Commissioner. I just want to, Councilor Zimmerman, couldn't agree with you more about the need to focus on the high acuity part of the behavioral health system and the access that the Portland metro region has to that set of services. As we've seen lack of access to the state hospital for people who meet criteria for civil commitment, we're seeing decreased access in secure residential treatment facilities and residential treatment facilities in favor of those who can't aid and assist in their own defense or who have been incarcerated. So all of those are big problems to have and worthy, but the lack of access and increasing lack of access for folks that meet that civil commitment criteria, I think, is a huge part of the challenge that we're facing together, and that is not something that we can solve alone. So thanks for elevating that. Want to thank the staff team for being responsive to our feedback. I see lots of places where we had discussions at this table reflected in the document, so thank you. I think there are a couple of more places where either CCOs or different parts of the health system could be helpful, so I'll send that offline to you. And one of those areas is in using some of our new data to understand the specific need of the folks that we are trying to house. So reflecting that in the build section, I heard Commissioner Singleton talking about this. If we have, very nearly a third of the population accessing different services that need support in opioid use disorder, stimulant use disorder, or psychosis, like, let's make sure that we're building for a situation where those services are available. And then my question for Ryan and Jillian is, I just want to hear, does this plan work for you? You guys picked up the pieces of a plan that you inherited. You did a lot of work to move things forward. Ultimately, sort of to the mayor's point, like, this has to be an iterative, kind of continuous improvement system, and we're trying to build a system, and we're doing our best to write that in discrete action elements that we can like all commit to together. But I want to just ask, does this give you all the framework to really push and lead faster, more, the sense of urgency that's required in this? Would just love your reflections on that.
Well, Mindy, I love that you made this about me. So I'll make it about me. The reorganization alone, seriously, that's just how my brain works. I needed things in these buckets, and to be able, especially to external partners, when they ask, what are you doing to reduce inflow? Like before, it was like just littered throughout the plan. It's like, nope. Here it is. Here's the list. Here's the priority order. Do you have an opinion on that? Is there something we should be doing different, or are we missing anybody who needs to be part of these conversations? That alone, it feels so much better. The foundation under us is much stronger with this version. So Ryan, how do you feel?
We've worked a while to improve it. So in general, yes, it's moving in the right direction that makes so much more of this actionable. So we were able to refine action items that had existed in the prior version of the plan, where very frankly, we looked at it with a lot of people who work in these systems every day, and they were like, we don't know what this means. And so we were able to take that and define some meaning where there's actually actionable work to be able to move forward. The piece where I think we'll continue to always have struggle is there are still 90 action items here. The breadth of the work is very, very significant, and our ability to continue to organize partners around it is dependent on their level of resource that we're collectively able to put to it. So as our systems become increasingly strained by some of the budget reductions that are coming forward, I think we'll be in conversation with you and with our respected elected bodies to try to understand if we need to prioritize beyond what's already here, how do we go about doing that? So again, but we'll look to be very much in dialogue with all of you. And I think this plan structure gives us a much better grounding for talking about those priorities.
Okay,
Yep.
Thanks. I appreciate that. And part of the reason I ask is certainly it is the elected bodies' accountability to ensure that this happens. We are holding accountability together at this table, but the responsibility for executing on this really lies with the team, and kind of the need to make rapid movement is really important. So if this supports your ability to do that, I'm happy to support it.
Thank you, Ivory.
One item I wanted to add was related to the action items and the responsible parties. Commissioner Singleton had mentioned that we should call out or either just make a notation of some of the outside influences on ensuring that we can meet these action items that might be the result of reduction. And hopefully, I'm being optimistic in the future, increases in resources from the state. Yeah. But I also like for us to also add that note for the federal partners as well, because I think that's super important too as we, comply with this version of our plan and then future versions of our plan. I think it's important for the community to understand like some of the outside influences that we're dealing with in these lean times that are ahead. Thank you.
I was just going to add some comments or just say I appreciate Councilor Zimmerman's reflections and Mindy's as well. As I share a lot of alignment in terms of the broader, the broader like support that we need from our state officials as well as far as our behavioral health system. But a couple questions came to mind that maybe I also don't see reflected in here. Is that we have in our goal 3 on our outflow and the conversations around permanent supported housing. For me, it's always been a question, as we've kind of talked here, that like folks are failing out of that. They shouldn't be failing out of that, right? That should be the epitome of being of supports that someone needs, and yet that's happening. And I'm curious if we have done or if we intend to do a process of of understanding that from those community-based organizations? Like, are we, I mean, are we going to actually like interview folks or I would like to know the why, like hearing not only maybe from individuals that have left, but also like staff, because I think what we could be doing already on the front end is supporting what already exists by identifying what's missing or what they need. And that could be an immediate way of how we allocate funds versus sort of like, I'm hearing a lot of things that feels like we have to reinvent or build up things that we don't have versus putting investment in what we do have and identifying why it isn't working. And so for me, I think that would be really helpful information so that we understand what is going on that level and filtering that back. And then the other question I had was around the allocate, or like if we're getting information from folks that are going into on the by name list that are identifying or self-reports of how they became homeless. Is that being asked, or is there any place to sort of assess that? Because I wonder, I mean, and I don't know how, accurate that would be, but then that would be sort of getting this story of everyone that's within our system of, what was their reason? Where was it, were you impacted by health and that like eventually you lost your housing? Were you impacted by substance use? Were you impacted by, and then that is being driven, our actions are being driven and informed by the people actually in the system and what it was that they needed. I did hear sort of, and Councilor Zimmerman identifying that. So I don't know if there's an ability to do that. I don't know how accurate that would be, but perhaps that could help inform from the actual folks that are in our system too. And then sort of drive again where we're putting our funding and our needs. And then the last thing I was just going to add, and again, this for me feels back to the conversations that we need to have on a state level is, and then also circles and connects with permanent supported housing is again, our like with safety and outreach, the higher level, I mean, same with permanent supportive housing, I think of like our ACT level supports and all of these intensive behavioral health community supports that are supposed to be intended to be catch nets for the highest acuity of our populations. Those are also defunct. There's not enough of them. The staff aren't supported there. Again, to me, that's opportunities of looking at and investing in what exists, understanding what's missing and needed there. And how do we, and then taking that where we need to in terms of, is that additional support that we need from a state level? Do we need the merriment of the functionality of an actual psychiatric hospital with pathways for folks that are, being supported by intensive community outreach programs, and then those pathways into continuing to wrap folks in permanent supportive housing to create that stability of handholding through an entire process that needs to occur.
So Chair, would you mind if we speak to that for just a bit?
No, I don't mind at
Because
all.
a lot of what you spoke to is underway. So I'm going to have Ryan speak to the pilot that is being designed right now regarding placements in inpatient psych settings, behavioral health settings. But then also I'm going to jump ahead of him for a second and say, one of our KPIs, right, is around this, is that behavioral health KPI, and segmenting that group of folks. We're going to first target in 200 to 300 folks. We're doing a refresh data pool with HealthShare right now to know the exact number. But in addition to that, and this is news for Mindy, the thing we're going to ask next with that matching is we do want to just everybody in PSH and do the match there with the Medicaid claims data. And then also everybody on the coordinated entry list. So I will send you that email later today. Sorry, I just have not done that yet. But I'm going to kick it over to Ryan to talk about some of the pilots we're looking at.
Yeah, and I would say, like, just broadly looking at the connections that you're looking for between our housing and behavioral health systems, it is going to be a long process for the state to fully build out a functional behavioral health system. And in the meantime, we're working, and you see this reflected throughout the plan, predominantly in goal area 4 around the systems integration and care coordination work. To try to knit together those systems as closely as we can, even while we're trying to build toward that better capacity. So a couple of things that I wanted to note. I mean, we have talked about the concern of folks failing out of permanent supportive housing. I think it's important to carry the context that it's about 85% of folks 2 years into permanent supportive housing are retaining that permanent supportive housing. So it does work very well for most people. Even when we look at some of the data analysis that we've been able to do with HealthShare, the high acuity behavioral health cohort that HealthShare has identified. So folks who have stimulant use disorders, folks who have opioid use disorders, and or folks who have psychosis, those folks are failing out of permanent supportive housing at almost twice the rate of folks who don't have that, but it's still only about 10% of those folks. So for about 90% of those folks, they are successful in PSH. I just wanted to make sure that we carried that context.
And that's our KPI
Yep.
that you see.
Exactly.
Yeah.
And so, but moving forward, couple of really key pieces, trying to get at some initial work around what you're talking about. So first, there's an action plan associated with trying to expand enhanced care coordination for folks who are in PSH, really looking for that retention so that we have connections back to the behavioral health system, particularly when folks are starting to decompensate in the housing that they're in. But also, Jillian mentioned the pilot that we're working on, which is helping to build a better pathway between inpatient stabilization services like inpatient psychiatric stays into PSH at that point. So folks aren't coming out of that inpatient stabilization and then returning to the street, but instead are coming back into the more supportive environment of PSH. So again, it doesn't fix the entire context, but it's building system connections to try to improve that as we go.
Quick question, if you don't mind.
Yes, Mayor, please.
Oh, I had it on. Ryan, so do you have benchmarking data on the 85% to show where our system compares to the national average or other model environments? It might be good to add that because that way, if we're underperforming, it gives us a focal point. If we're overperforming, then we can perhaps discount, and then we're learning from other organizations. Just kind of, I mean, it's like it's hard for me to orient where we're doing well or we're not,
So I can follow up with some benchmarking data. If we actually perform well above the national average in that particular retention rate, especially at 1 year where we're above 90. So so that is something, I mean, that being said, there's always something to learn from places that are well performing above us, but yes, we are performing well above them.
It would just help us on the action items to know if we truly need to action or are we wasting time where we could be focusing on a different population.
Well, and what I'll add to that question related back to Laura, your question, is that almost, I wouldn't say regardless of how we're performing on the data side, we hear really clearly from staff who are in permanent supportive housing environments that it is incredibly challenging to work with the relatively few folks who are in the midst of destabilization and need that intensive supportive service to stay effectively in their housing. So it's both that we hear on the staff level side that this is a really, really important group to focus on, even if it's relatively small.
And I think I mentioned this in the last meeting, to your point, we do perform really well nationally with that metric. I think the concern is those folks who potentially should be in permanent supportive housing or that higher level of wraparound services who aren't. And that's where we're seeing challenges with people being able to stay successfully in help housing. So I think and we hear from housing providers about that too. So I think that's also, a part of this is what does the size of that system, the PSH system, actually need to be, and at what level of care to make sure that we have the resources to adequately place people and service people at the level that they need, knowing that, to go back to the previous conversation, that some folks are going to need that highest level of care that in the community we may not be able to offer initially. They initially need it. So, okay. Thank you, Commissioner Singleton. And then I'm going to see if we can, because we do want to get into the KPIs, so see if we can move forward.
So One thing I'm not sure that is easy to capture in the data around PSH is the rehousing, right? Because if somebody falls out of their existing apartment, but we rehouse them in another PSH, it shows up. Does it show up as a not retained and then rehoused? How is, and maybe that's a longer conversation.
So someone who is able to be directly rehoused, meaning they move from PSH to a better match, would actually show as a positive exit into another housing, so they wouldn't show up as not retained.
Okay, I want to dig into that more with you on the 83%, because if we're, even if it's a positive exit, it's still an exit. So is it actually showing up in the retention numbers, or is it showing up as a new placement?
That's a good question, and I can get back to you on that.
Okay.
Yeah.
And part of it is just, I think, I want us to actually know what the percentage is that are actually losing apartments. And the other, and I said this, and I'll just have to keep saying it because it feels really critical, is we do not resource every agency to do PSH to the level of fidelity of the model that we know is most effective for people experiencing chronic homelessness. And I think we have to start with that assessment, because right now there is some matching that happens at coordinated access, but it's not quite to the level of detail to what the agency is actually resourced to do. And I think that's a critical piece to look at. And I keep looking at you all, but I know it's the department. You don't have, you're not a part of that conversation, of the actual matching conversation. And then lastly, I will say, and you all know this, but this regional alignment and the one action item around defining PSH makes me want to scream. There is a national definition of PSH. I know that this is a conversation that Metro needs to have, but this is part of what I was referring to with the resource allocation discussion, that if we're using population A and we're putting people who don't need PSH in other communities into PSH, it means that we don't have the resource to serve the need that we have in Multnomah County. And I think we've got to have that conversation, not just as us, so we all understand it and can be on the same page, but then to have that with the other counties and with Metro. And I don't mean to say that the other counties aren't doing good work. I just mean to say that SHS is a precious resource
Mhm.
that we actually have to focus on those highest cost people who, when we don't house them, they're costing us money elsewhere in the system. So I will still be supportive, but that is a big one for me, that I'm like, we should not be defining locally what PSH is. That is a thing in social services that has evidence behind it. So that's something that I have a lot of strong feelings about.
I will send a timestamp to Liam for us and tell him to listen.
Um, if I think we got into it a little bit last time, I'm just trying to remember, so if you've got 10 people and they have a variety of. Thank you. If you have 10 people and they have a variety of needs that all fall in the PSH realm, and you've also talked about some of the, we resource differently. So I guess what I'm trying to, because I appreciate your answer and or your point that you're making, and I'm trying to better understand it, and I'm hoping you can help me out. So if there's a definition of PSH and some organizations are more equipped to deal with a person who has name the thing, and another organization who seems to be more equipped with the other thing. Can you help me out in terms of how we say, or how we articulate and fund PSH based on different needs of the population that's within a building or within a community, given that there is a definition? I'm looking for a little bit more specificity.
Yeah.
So when you say it makes you want to scream, I was kind of like, why do I want more specificity if this is making her, who I think probably knows more than I do on this topic, want to scream? I need a little help there.
Yeah, absolutely. Part of it is the HUD grants. And so when HUD funds PSH, they only fund certain types of staffing. So at Join, for example, if I wanted a mental health professional, I had to figure out how to do that. And I ended up contracting with somebody to do mental health services, as opposed to if I'm Cascadia, where I have mental health trained staff. And so my voucher, the services on my voucher look really different depending on that organization. And one model cost us more money locally, while the other model can rely a little more heavily on federal dollars. So that's, and they both qualify as PSH.
So what is what is the point of the definition?
So the definition, that's the thing for me, is where I don't think we've resourced people to do it to fidelity. It's going to look much more like the ACT team, where there's interdisciplinary. You have behavioral health, both mental health and addiction. You might have a healthcare navigator. You might have you'll have a housing case manager as well, who's doing some of that soft skills, getting along with your neighbors, those kinds of supports, right? Connection to food bank. And then you also can have, who am I missing? Oh, I said healthcare navigator. So those are some of the pieces that usually come with PSH, but what we have is a lot of vouchers with housing case managers.
Got it.
And no, none of that other service. Yeah.
Okay, thank you. I appreciate the conversation. This has been really helpful, and lots of things obviously that we can look forward to as we're really improving the system and trying to get the system set up and resourced in the way. I mean, to me, that, and the mayor and I have lots of conversations about this. Like, to me, it is as we are setting up the system, making sure that we are resourcing things properly so it can function as a true system is key. So I really appreciate this conversation. I am going to go ahead and move us to a vote. I think I appreciate all the insights, and really underlines for me why it's so important to have folks here from different jurisdictions, from healthcare, from behavioral health, from housing, from community, because so that we can be bringing these perspectives. And I just wanted to give you if there was anything you wanted to add to the conversation before we go to this.
No, I think I'm supportive. I also just want to say that I really appreciate all the work of the advisory committee and taking a lot of time to be reviewing this and provide a recommendation via letter. I really appreciate that a lot. And I think we've had enough discussion on this that I'm pretty up to speed.
Okay, great. Thank you. All right. So just as a reminder, each member is going to indicate 1, 2, or 3 reflective of the following, which 1 indicates full support for the proposal as stated, a yes vote. 2 indicates that the participant agrees with the proposal, but would prefer to have it modified in some manner in order to give it full support. Nevertheless, the member is voting yes, even if their suggested modifications are not supported by the rest of the committee. 3 indicates refusal to support the proposal as stated, it is a no vote. And then if all voting members are 1 and 2, the working group has reached a consensus. And then, so we do that with all members of the group, and then we can do an official group vote of all the voting members. So with that, I will open it up for voting. I'll just go through folks, and Mindy, I will start with.
Sorry, Chair, just quickly, what are we voting? We're voting on the plan to move forward to what?
Yeah.
Okay.
Referral vote. So what y'all do is
Thank you.
We're required to refer the action plan and hopefully also the key performance indicators to the Multnomah County Board of Commissioners and the Portland City Council, where they also will vote. So this is I call it a referral vote. It's 2 separate votes. Yes, Mayor.
Yeah, so this one is for the HRAP action plan. And then the next vote will be taken at later in the meeting. And that'll go over the key metrics that we've been talking about, percentages and stuff. Okay. very good.
Exactly.
Okay, very good.
Can I ask a clarifying question?
Please do.
Just out of curiosity, so this is referring this plan to both governing bodies for kind of ratification, but if there is feedback from, say, Multnomah County that doesn't align with the discussion that happens at council at the city, how is that resolved? If there's a difference in opinion in some element?
Have to resolve it.
I mean, does it come back to this group for further discussion and we have to vote again to refer, or?
That's an interesting scenario to think about. This is the first time we're doing this. And so I'm going to cross that bridge if it happens.
Good luck.
So, and I will say, just thinking back to the last time we were doing the IGA process and something, we had a lot of back and forth in conversation between the city and the county when there were areas. So I think that this is what this vote today allows us to do, is to begin that work of familiarizing the commission, the Board of Commissioners, and City Council with the plan more so, and finding out where things are, and then seeing where folks are. With the vote, and then hopefully having votes scheduled at those bodies and and trying to make sure that we are in alignment before that happens.
And I will do engagement with all non-SOC electeds in the following weeks. And also it is certainly, we welcome the electeds of this weighing in with their colleagues. And also we welcome involvement from the non-voting members to send emails or make phone calls in support of this.
Yeah, and we did, like with the last IGA, we did have to go back and forth between the two bodies. It's a little bit different now because it's not one thing that we're voting on. People can vote separately. I do think that if there's big differences than what we voted on here today as this body, then we should bring those changes back. But but hopefully that they will understand, like, there's been a lot of work happening in this process to do that. But
Yeah.
okay. All right. Okay.
Okay, so if we were to pass this action plan
Mhm.
forward to both bodies, the next item agenda is to discuss this KPI. So obviously, we've had some discussion around about some things we'd like to see in it. So I guess I'm having some reservations about a yay vote, given that I think this was a good conversation. What I'm trying to understand is your intent with those, a lot of those comments fall into, you think
Yep.
more of this area
Yes,
or
they
more
do.
of this area?
Now, most of your comments in particular were more about the KPI piece of.
Okay, and so in a situation where we may be polishing KPIs, the two bodies could vote on this even if there are then changes that,
Yeah, they can move separately.
okay. I'm thinking through that for a second.
I'm calling you first then.
Please.
So I'm going to go to Mindy Statlander, and again, 1, 2, or 3.
Thanks, Chair. I'm a 1, supportive.
Thank you.
Sure. I'm sorry, I do have a question before we go. You mentioned if there's a 3, there's not a consensus, and what happens if that occurs, if this is not a consensus vote?
So if there is a 3, so this is the consensus of the larger group. The actual voting members are the elected officials, and so so we will just have a like majority vote at that.
It would still go.
Yes.
It doesn't stop it from going forward.
Right.
Chair can still call for it.
Thank you.
Okay, great. Okay, so we have a 1 from Mindy, Commissioner Singleton.
2.
Mayor?
2.
Okay. Anna?
1.
Okay, I'm a 1.
1.
1.
Okay, and Counselor Zimmerman?
2.
Okay, great. Thank you for that. Oh,
Oh, is
Peter,
he?
thank you for
Well,
the-
is he able to talk? Because I want to be, he's dealing, oh, there he is.
I'm going to abstain since I didn't catch some of the conversation. It feels inappropriate for me to vote.
That makes sense. Thank you, Peter. We appreciate you being able to join as you can today. All right, so thank you for that. We're going to now go through the elected officials and have a vote. Again, 1, 2, or 3. And we'll start with Commissioner Singleton.
2.
A 2 with a pointed note. The HRAP as developed and designed has not met its goals. Our city and our county continue to fall deeper into a homelessness crisis, with it being borne out on the street and in our homes. And so I'm going to vote for a 2. And as I stated earlier in this meeting, I'm all in with the discussion, and I'm going to continue to stay this in the next item as well, Jillian, as the director. I want us to focus more on inch stones, not milestones, and to drive the city and county forward with immediate and concrete changes to start turning the ship around. Okay? Thank you.
Thank you. So I'm a 1, and I just want to take the moment to thank all of the folks who had made this, the HRS team, our advisory committees, the implementation committee. This is taking kind of the first iteration of this and moving it to something that we really are going to use as the basis of our plan to make it actionable, to make it that we are going to drive our KPIs that we're going to be measuring ourselves to, and really giving us some ways to move forward with both the activities we have control of, but again, as I said earlier, like the advocacy and the united advocacy, I think that we need to do to get some of these resources into our community. So thank you. Counselor Zimmerman?
And the difference between the last vote and this vote, please?
None.
So what is the purpose of
This,
it?
this one is the official vote.
The official referral.
Yeah.
The elected officials hold that ability to be
Thanks. 2.
the final say.
Okay, great. So with that, it passes then to referral to both City Council, Portland City Council, and Multnomah County Board of Commissioners. All right, thank you. So I'm going to turn it over to Ryan and Lori to bring us into the further into our conversation on key performance indicators.
Very glad to be with all of you again. I didn't introduce myself at the beginning, so, and I don't know that I need to state it for the record, but regardless, Ryan Dybert, I use he, him pronouns. Really glad to be with you, especially to be here with Lori Kelly from the Homeless Services Department, to continue our conversation that we started several months ago with this body, with our Community Advisory Committee and our Implementation Committee, to think about how we're measuring the progress of our plan. When you look at the initial version of the Homelessness Response Action Plan, one of the pieces that we heard even from the very beginning of that, straight out of the gate, was that the key performance indicators that were associated with that plan were helpful for understanding some aspects of what was going on at the system level, but that it didn't give us a robust enough picture that we could actually measure our success as we move forward. So we have been focusing, if you'll go to the next slide, Maggie, we've been focusing all of our conversations to date within this body, really at that sort of pink level, the key performance indicator level, knowing that and asking the questions of what do you want to measure as a system, knowing that there were some more difficult conversations to get into to set specific goals or targets associated with those measures. So today's conversation is the first one that moves us into sort of that green box. But also just as a reminder, each of the key performance indicators that we're going to be talking about will also have that set of sub-indicators, including equity-focused sub-indicators that help us understand really additional system-level detail, all the way down to contract-level metrics that we can measure in terms of the performance of individual providers that we contract with. So, just a reminder that as we focus here in the pink and green areas, that it is not at all exclusive of, it ties very directly to a set of indicators that go further below that. I also want to start with acknowledgement that what we're working with today, the key performance indicators that we're going to talk about, are the ones that you asked us to move forward with, 12 key performance indicators, and that you wanted us to help you understand how we could go about setting goals for that. So that's really what we come here with. If we can go to the next slide. Just a reminder that as we brought you those key performance indicators, the options for those, we also talked about different strategies for how you could set or track benchmarks or goals associated with each of those. For some of them, we've suggested just tracking them in order to understand them as, are things shifting in the landscape associated with this work without setting specific goals associated with them. So that's where you'll see those surrounded in blue in the next couple of slides. For others, we suggested setting specific numeric or directional goals. So you'll see those outlined in red, orange, and green in the upcoming slides. But just a reminder to the approach. So some of these we're just going to track and see how they're moving to understand our landscape. Others we want to be able to set goals for. Next slide. So again, you previously directed us to work on 12 system level KPIs, 3 of which cross the full continuum of work that's outlined in the HRAP. And if you'll go to the next slide, an additional 9, which were more closely tracking inflow, outflow, and safety on and off the streets. So on Friday, we sent you an updated definitions document. There's a copy of that in your packet. It's the one with the blue and yellow highlighting throughout, outlining some goal setting approaches for each of those KPIs. Again, in this slide, those are the ones that are outlined in red, orange, and green. We're briefly going to talk through those today for the group to discuss and determine how to move forward. So I'm going to dig deepest in our discussion here on KPIs number 1, the total number of people experiencing homelessness, and KPI number 8, the portion of those who are unsheltered. Mostly to illustrate the approach that we're recommending around goal setting, but we can discuss all of them in detail as you want to. I'll note that Director Hisrich is also here from the Portland Housing Bureau to talk through the recommended goal setting approaches to KPI number 3 around increasing our supply of deeply affordable housing. So we'll come to that at the end of this presentation. But just to walk you through the general goal setting approach, I think it's really important to start by grounding ourselves in our current state. We have to understand if we're setting a goal towards something, we want to understand where we are right now relative to that. So a few slides to walk us through that. Thank you, Maggie. So this is reflective of data that's on our HRAP dashboard. We've tracked this all throughout. You see this in our quarterly reports. We are on track to meet our existing HRAP goal to shelter or house 18,650 people over 2 years. In fact, we've likely exceeded that number within the quarter that just ended as of September. We're in the process of pulling that data and being able to run it for our next quarterly report right now, but we expect that we'll get beyond that goal. Next slide. And then showing you data that's available on the Homeless Services Department dashboard that tracks our system-wide outcomes associated with the work, whether it's funded by City of Portland, Gresham, or Multnomah County. So this is system-wide look. Just to highlight here that what you're seeing across time is that we're newly housing across our systems on average roughly about 330 people per month, and we're helping about 8,600 other people maintain their housing through after returning from homelessness, so receiving some form of ongoing support. I'll say that level of folks newly into housing on a monthly basis is down slightly from some of our highest levels of housing placement over this time period, mostly due to the budget constraints that we've faced in the last year. But in general, this is what you're seeing is the highest level of ongoing stabilization for folks who were formerly homeless that we've ever done as a system. So that said, if you'll go to the next slide, over the last 18 months, again, this is available on the Homeless Services dashboard, in all but 2 of the last 18 months, inflow to homelessness has outpaced outflow from homelessness. So in general, what we're seeing, if you look at the average over the last 6 months, about 1,400 people are coming into homelessness each month. 1,000 of those folks are people that we have never seen in our system before, or who have not had touches to our systems for at least 2 years. So significant levels of incoming homelessness on a monthly basis. On average, over that same 6 months, our outflow from homelessness is around 1,100 per month. So the net increase is about 275 people per month when you put inflow against outflow. So on the next slide, again, this is from the Homeless Services Department dashboard. You're seeing that net increase of about 275 people per month. And this trend is the baseline from which we're setting our goals for all of our future work. So we've been working over the last several weeks closely with Lori and her team, especially Claudia Sherrigan, to begin estimating relative levels of effort that it would take to begin shifting these trends that you're seeing here in the other direction. So I want to take a little bit of time and just illustrate what that looks like in the estimation process. Go ahead, Mayor.
Ryan, could you go back, please?
Yeah.
Would you take a moment and give me a definition of what unknown means in this recording?
Sounds like that's a question for me. Effectively, these are human beings, right? So we're able to track to a certain extent where they are, but where people are is calculated where they are the last day of the month. We need to take a snapshot somehow. And generally we can understand if somebody's sheltered because we know they're in a shelter. We understand if they're unsheltered because in some way they've had a recent enough meaningful interaction with somebody where we know where they saw them or where they said they were going to go. There are some people, especially people who don't have a rich interaction, day center is working quickly through outreach, where we can't with any certainty say we knew they were unsheltered or sheltered in that moment. And so that large number there are people who tend to have, for want of a better term, light touch interactions with our system. As time goes by, we'll be able to probably tell where they are, or they may be experiencing a level of episodic homelessness where they disappear and it's hard to tell. I think this also kind of highlights the complications of data in the massive context we're going at, which is that many of the people here are very likely experiencing some level of brief episodic homelessness. So we're not going to ever know where they were if they touched the system once, because they didn't tell us, hey, I'm going to go and go with my aunt, or I'm going to go to shelter. So we have to kind of make a guess. In the name of being transparent and also making sure that we're not saying we're accurately telling you something we definitively do not know, put people in that category.
Okay, so it's conservatively high. So what
Yes.
is your tail? In other words, if somebody isn't in shelter or unsheltered, they're in your unknown, how long is that tail? 90 days, 6 months before they would fall off as an unknown, or?
That's a great question. So the way this data flows is that in that month, we've interacted with them and we figure out that data. As they move along, each month we're going to take a snapshot in that moment. They disappear from our list, our active list, after 90 days if they've had a light touch, but longer if they have a concerted interaction, meaning if they're in coordinated entry or something like that, where we can really know where they are, but people just simply haven't updated them because they're in the same state, they stay longer on the list.
Great, so the tail is about 90 days at the minimum. Okay, thank you.
So, and this is actually really helpful because part of where we are now in terms of the data collection and some of the analysis that we're able to do is we're able to understand this in that dynamic way. People coming into homelessness, people leaving homelessness, in ways that we haven't had as solid a data infrastructure to do before. So you're really seeing the movement toward this more dynamic picture. So I appreciate that question, Mayor, because it helps to uh, demonstrate that. So you'll see here a whole slide of caveats. I'm not going to read them, but importantly, just to before we wade into some of these estimations, I want to be able to say that we're trying to help you understand a framework by which our elected bodies can set goals for these KPIs associated with this plan. I think it's important to understand that, you know, we've been able to work based on our existing performance data to look at inflow, outflow, other outcomes data. Currently, that's data, like actual data through the end of July 2025. That lets us estimate future conditions, but they're meant to get at orders of magnitude. So I've been describing this as we want to at least get you in the right neighborhood, even if we're not even fully in the ballpark yet, right? So these are orders of magnitude estimates. They're not at all meant to be highly specific, but it should give you an idea of the broad brush sense of the levels of effort that we would need to take to get additional movement in these outcomes, given what we're seeing. So the intent, and we'll talk about this in some detail, is to give this body in particular, but then ultimately City Council and the Board of County Commissioners, a general framework in which you can recommend those goals. But then those goals have to attach responsibly to budgets and scales of different programming. And this is where we really get, Counselor, at some of your questions of how much of which thing. And we can help to model that as we get into the FY27 budget discussions. And this is really intended to give you a framework to start deeply into those conversations if we're moving in the right direction. So I think in general, it's easier to show you how these estimates work relative to the KPIs than describe it. So if we go to the next slide, we can look first at KPI number 1, which is total numbers of people experiencing homelessness. And I'll walk you through how this plays out in some of the different estimate scenarios that we've been working with. So to the left on this graph is our actual number of people from our by name list who were known to be experiencing homelessness through the end of July. So that's everything to the left of the red shading. That's actual data. In the estimation work, what we've done is modeled that for the remainder of the fiscal year, we're going to continue to see increases in that net monthly number of people homeless that follows the same trend line that we're on right now. So on average, we're going to be increasing by about 1 to 2% a month. It's about 275 people per month. That runs through the end of fiscal year 26 for purposes of these estimations, at which point we try to make different assumptions about the outcomes we would get through increased levels of effort. So in this first scenario, what you're seeing is that as of the beginning of fiscal year 2027, starting in July 1st, rather than seeing a 1 to 2% increase on a monthly basis, you're starting to see a 1% decrease in that overall population of folks experiencing homelessness. To get there, you would have to increase our relative level of effort around prevention and placement of folks by 50% above our current baseline. So in other words, right now, our system has the capacity to work with about 25,000 people over a 2-year period. You would have to increase that by 50% so that we can get an additional 13,000 folks. On net, that would get you about a 20% decrease in the level of homelessness from the edge of that red space to the edge of that green space. But in doing so, you'd get roughly back to where we were in terms of the overall levels as of the beginning of this calendar year. So it's a 20% reduction starting at the point of the new interventions over those 2 years. But it would return us to a state that's relatively similar to what we saw at the beginning of this calendar year, if that makes sense. So if you go to the next slide, this is that same, so this is the second scenario that we described throughout the definitions document. So in the second scenario, you have the same conditions through the end of June of 2026, but then we shift instead of a 1% month-to-month reduction to a 5% month-to-month reduction. So that would be an incredibly aggressive shift in the level of resource and effort that we're putting to this work. It would require effectively almost a doubling of the number of people over 2 years that we're working with around housing and prevention compared to what we're doing right now. And it would on net get you about a 70% reduction in the total number of people experiencing homelessness from the edge of the red to the edge of the green. Now, I want to say that this scenario, while it works as math on a spreadsheet, is very likely not feasible in our current fiscal context. We have had periods where we have doubled the level of effort of our systems a couple of times over the past 10 years. But each of those was in an environment where we had significant new resources that we were able to work with, either at the federal level or more significantly at the onset of the supportive housing services resources as they came into the mix. Instead, we're looking into a situation where we have year-to-year fiscal constraints at the local level, at the regional level, and we're probably looking at significant declines in our federal resources as well over the next couple of years. So I want to say, while these work as numbers in the real world, and it's helpful to think about conceptually for goal setting, in the real world, this would both be really fiscally challenged and would be a significant strain on the ramp up of the systems to achieve, even if we had the money.
Yeah, Councilor Zimmerman.
Ryan, you mentioned that we've had twice where we got significant funding. Did we see a decrease like this when we did have more funding?
Mm-hmm. Yeah, and what I would say is usually what we saw was a temporary decrease where we were able to move things for a couple of years. And then we've had the inflow dynamic, the pressures that are pushing the numbers of people coming into homelessness has also gotten worse during each of those periods, such that the temporary gains that we saw started to get outpaced by some of those broader inflow pressures. So that's where you see, for instance, like the importance of looking at our affordable housing supply and broadly at our like at all of our housing supply being incorporated into this plan. That that's a recognition that you have to get ahead of those external dynamics or you never get ahead of inflow.
Director Matthews.
Without looking at the data and understanding what years we might be referencing, I would imagine that if we were having this conversation in 2022, then we would aggressively go with scenario 2 because we saw, we knew that based on our local resources that we were going to have some physical units that were coming online very shortly because of our previous commitments with affordable housing that would be able to house these families. And we also were taking advantage of a lot of the federal resources that were coming from programs that were created out of COVID and other places that we were nationally. And then also by taxpayer support with our resources here in the community. So just wanted to add that.
Yep. And to be clear, as we walk through these scenarios, we wanted to set this up as a framework so that you could think about how to move KPI recommendations forward to the respective elected bodies. We're not going to ask at the end of the day that you choose between scenario 1 and 2. We're going to ask that, like, if this is generally in the right direction for those discussions, there's a lot of ratcheting down that we need to get so that any of this has the level of specificity that it would need to be fully informed by our FY25 outcomes, to be fully informed by the cost per interventions that came out of this last fiscal year, but also to be able to understand, you know, the important caveat that was on one of the prior slides, that direction that you're seeing inside the red area for the rest of this fiscal year doesn't account for the rebalance conversations that are going on right now at both the city and county to adjust for state level cuts. It doesn't account for potential impacts of federal funding cuts that may come even during this fiscal year. So we want to be able to understand a little more of what's going on in the environment before we would ask either elected bodies to sign on to a specific goal. But we're trying to give you a sense of the ranges of how this could be modeled out.
Chair, I'm just curious. I mean, this is our first one. So how are we going through these, right? Are we going to do each one of these? Or are we going to, how's this working?
You want to speak to that?
Yeah. So what we'll do, we'll go through, what I'd like to be able to do is at least go through the body of the work, because each of these gets closely tied to the other. So I want to be able to at least talk about how it threads through. And then as we come around at the end, you know, what we're looking for ultimately is whether or not you feel like you can approve this as an outline for continuing conversations with the city council and county board while we wait on the additional specificity around those other data points coming out of FY25, FY26. And as we start to understand what December budget forecasts look like.
Do you want us asking questions as we go through this, or we just
Yeah.
wait until the end of this? Because I think we've all got some that have
Yeah.
already popped.
So,
Great.
so we have a couple questions now. How many scenarios are you going through for the different KPIs?
So I'm going to go in depth on this one and KPI number 8, and then breeze over every other one. And Director Hisarich has some additional detail on the one from PHB. So we've got roughly an hour remaining in our time together, and I trust you all to go where we need to go.
Okay, so do we have questions on this specific KPI? Mayor? Okay, Mayor and Commissioner.
Ryan, Counselor asked a question, and it was financial input. Has it reduced homelessness? And I haven't seen it. And you'd answered, yes, it had.
Mhm.
Our overall homelessness has increased for 7 consecutive years. Am I wrong on that?
I don't think that's wrong. I don't have the
Okay.
data directly in front of me.
So I just wanted to clarify for the table. So no matter how much money we put into the system,
No.
Okay, just wanted to, you want to clarify that?
It's, we have seen when there's resource, like I mentioned about veterans, for example, we
Right.
actually reach functional zero, right? And so we've seen at those times where there's investments, a decrease and a significant decrease.
Right.
The problem is that decrease doesn't sustain because then we see a higher inflow. And so um, it's not something, we can't sustain the decrease in homelessness when we have more folks falling in. So that's kind of the challenge, is the resource, suddenly the numbers then the resource need doesn't meet the new numbers from the inflow.
I think what Commissioner Singleton said was spot on. That was 2015 when we focused on ending veterans homelessness with a White House focus. That was a population-specific focus. We focused on one population, which is what we used for community solutions type strategy, which we're using still. And I would just say I'm going to make a few points and then I'm just going to kind of temper it for the rest of the day because I'm going to support this. But going through this, my alarm is, did we use community solutions and did they consult us on these numbers? Right now, I'm being asked to choose between 70% and 20% without a modeling, without a spreadsheet, without looking at indicators. What are we going to do here to actually make changes? Reunification. At the city of Portland, we're expecting a 10% reduction in homelessness just on reunification. And we are looking at that every single week. We're modeling that. The other thing is tent distribution. We've discontinued it. We're using now community standards to enforce certain outcomes in our community. CBOs. What are we doing with CBOs? Councilor Green brought it up at our last meeting. We have 54 and 41% of our costs are going to back office redundancies. That's inefficiencies we can be looking at modeling. What would it look like if we started saying our new goal isn't 54 CBOs, it's 30. Don't get me wrong, I'm spitballing that. I'd want to know what can we do reasonably with the contracts we have and hold. Those are those inputs that we would model on to then create a 70 or 20. I honestly, in my professional career, if anybody walked in and said, we're gonna have a 20% savings next year without showing me the define, model, analyze, then make the improvement and then look at it, and then I would never listen to them at all. And if you even came into my office, I would turn around and walk away. So now we're doing it professionally with $300 million. So I'm making my points because I'm going to support this. Jillian and I had a conversation yesterday. I want to make sure we can get into the nuts and bolts, look under the hood on an ongoing basis. I want to see spreadsheets with modeling. What are we going to change? Because money's changing, but it doesn't mean we fail because money goes away. It means we model and modify our activities. So again, I wanted to make that as an overarching, she and I go back and forth, and I appreciate you.
Yeah, no, I just want to layer on here and connect the two for a quick second I'm going to put it in my plain language. And I think you're talking about strategies and program. Those conversations will and do happen all the time. Like reunification is a program level activity with a goal, and it lives in your decision package under the SSCC. It's great. It's awesome. It's there. High five. But I just want to say this sort of ebb and flow of like we target a population, we solve it, but inflow continues to happen because we are chasing the problem at the end of the day because it's a housing problem. If we never fix the housing production piece of this, which has never recovered since the Great Recession in this community, like we will always be in this cycle. So housing.
Right. And that becomes our model equation.
Yeah.
We have to look at it on a line item. What's our expectation? What's Portland doing? What's county doing to change that activity? But it's one activity. We have so many levers. I don't want us to just say that's the reason and then say, well, that macro reason is going to take 5 years to adjust.
Yeah.
While we have people suffering today, we can't do that.
Yep.
Yeah.
So
Our new mantra is no one is coming to save us. So what can we do, Mayor?
I appreciate that. Jillian, I appreciate that.
And, oh, go ahead.
No, go ahead.
What I would add is that level of specificity in modeling, you hear that I have like really strongly avoided saying that we are offering you modeling today because what we're offering
It
you
would
is
take
that
forever.
broadest range estimates. as we get into the more detailed conversations with the elected bodies about how much of which types of interventions, how much permanent supportive housing, how much rapid rehousing, how much are we focusing on prevention instead, we can adjust that and get you something closer to that kind of a dynamic model that would understand it. And, we're able to do things like build in, for instance, if you're doing 30 diversions or reunifications per month over that 2-year period in the green window, that nets you about 720 of the 13,000 increase that we need to see to even get this less aggressive scenario. So how else are we getting those other 12,280, right?
And that's what I'm asking this body to do. And I'm asking for our time to be spent on. That's the modeling. And then we bring activities here and we vote on changes to activities to get certain outcomes. And that's what I want to, I'm hopeful we can do that. Is those are hard decisions. What are we going to change to get more money for PSH? What deliverables are we going to make in our shelter system? And what are our trade-offs? Those are the hard and important discussions that we should be having, that I want to have.
Yeah, thank you. So I'm going to go to Commissioner Singleton and then Councilor Zimmerman. I just want to respond though, Mayor. I mean, I agree that that is absolutely where we need to be going. But we have to have this conversation first so that we can be in alignment on the big goals that we're all reaching together. And then we can take that back, because ultimately, like, the reason we're having the city council and the board of commissioners approve these is because we have to be able to back that up with budget and resource allocation. Because if we don't, we're never going to do 20%, let alone 70%. We have to have like the buy-in to what we're trying to achieve and the realistic picture of what it's going to take to get there, so we can be budgeting that accordingly. And I think that is really key, especially as we are looking at not the 70%, scenario where we're having this big influx of money from either a local source or a federal source. So, Commissioner Singleton.
Thank you. I guess there's a question, is how much flexibility is there around, I think, needed pivots that will come in the next year around this? If HUD actually does what HUD's talking about doing and takes away permanent housing to convert it to transitional, that's a huge number of people that now we have to pivot and do eviction prevention for. And so I guess I'm not clear on, we vote here, council, commission votes on it, and suddenly HUD takes away most of our permanent supportive housing resource.
This is why today we are just asking you to refer this out as is. We are not asking you to choose the goal scenarios. So in my email, my really long email, the process, approve this today. Fiscal year 25 actuals are coming in the next few weeks. Then county gets done with its fiscal year 26 rebalance. City gets done with its technical adjustment ordinance, y'all call it now. The December forecast comes in mid-December for SHS and our general funds. Then we start into the fiscal year 27 budget process. We come back together as a group, pick the goal scenarios in July of 2026. Once the financial floor underneath us, while unstable as it may be, we actually know more things, and y'all can actually make responsible financial decisions.
Thank
You
you.
want this in your hands for the fiscal year 27 budget process, every elected official, to guide decisions for that budget process to come.
I appreciate that. And knowing it's on a different timeline is helpful. I thought this was moving at the same pace as the HREP plan, and was like, I'm not ready to vote on that.
Yeah.
Well, we
Thank you.
want referral votes so that we get this in front of the elected bodies before the end of the year, because our current set of KPIs do expire December.
Okay, sorry. It sounded like you said we're not voting on them as council and commission until July.
No. So sorry. Let me step back. I would love a referral vote today to take this document in its entirety, in its current form, to both elected bodies and get them to approve it so we have the new set of KPIs. But in terms of the KPIs that have specific goals, where Ryan has put goal scenarios, you're not picking the goal scenario until next summer. The financial floor underneath us is way too shaky for y'all to responsibly do that today.
Great.
Back in the spring, Did I envision it that way? No. But then the state legislature, we started this project and then the state legislature decided to cut eviction prevention and rapid rehousing by 75%, right? Ish, 73, I think. But you know, so some of the pieces have to fall down and settle so we can do the goal scenario choosing next summer. But the KPIs, what they are and what is highlighted in yellow is what you're approving today.
Thank you.
Okay, thank you. Counselor Zimmerman.
You had mentioned the net difference is about 275 a month who are inflowing into homelessness. Do we have an indication for what it is that those 275 are? What's the thing? What's bringing them into it?
I think unfortunately the short answer is no. We don't
Okay.
know why every person is flowing into homelessness. I mean, we're seeing a general, given the context and the size of the numbers, it's reasonable to assume when we compare this to, say, chronically homeless individuals, that a lot of these people are experiencing episodic homelessness and not necessarily like chronic homelessness. So that tends to be an economic factor that's pushing people in and out of homelessness, to be frank. And so you would assume a large percentage of that are experiencing that. And then there's a percentage that are becoming homeless because they were always going to become chronically homeless because they have a multitude of issues that we also need to address.
So we're getting the 275 because they're checking into some point in our system. We're
Yes.
getting them on the by name list, which is great. And your rationale makes a lot of sense to me. And I'm highlighting it as I'd love to then have the, out of 275, 10% would have become homeless regardless because of a lot of other issues that you've mentioned, but 90% are experiencing rent burden or whatever it was. It's economic, episodic, et cetera. I'm reminded of, I think it was 2, maybe 3 years ago here when we had our legislative breakfast and Representative Tana Sanchez kind of mentioned, she's like, to what end? Where does it end when it comes to long-term rent assistance? And she said it as a person who gives out rent assistance at her organization. For how many people are we going to be supporting in terms of the rent assistance? And so you said 8,600 are maintaining housing with some level of support that we're a part of. I'm assuming that means a lot of that is a rent assistance. Am I getting that right? Okay. So I guess, who is the 8,600 person? And if we were to rank order from income lowest to highest, what level is that last 100 in terms of income? What are we supporting them with? Like, where does that cutoff happen in our society for what is receiving what kind of help? Is it a rent check? Is it something else when we say we're helping maintain 8,600? And I ask that in context of, it was said earlier that we are doing relatively well nationally with some other indicators. And I'm trying to get a sense for like where we rank in that world of, do they have a similar percentage that those communities are then rent assisting or helping maintain? If we're leading the pack, we're somewhat leading the pack in other areas. Where are we at in this section? Is that number 30,000 a year as a family? Is that number 100,000 a year as a family? And then I have a follow-up. And I could really love real numbers instead of like 30% of this or 40% of that. Like people work in real numbers, and I know what 60,000 does. I don't know what 30,000 AMI does.
So I'm not going to be able to answer this in this moment, but I did want to verify your question so I can get you
Yeah.
an answer.
I recognize it might not be answered.
Oh, no, it's fine. I just want to make sure that we're getting you what you're asking, which is, I feel like what you're asking is you would like to know the relative range of income that we're providing assistance against, and then also the relative number of how much rent assistance we're giving in range. And I think we can do that in like chunks just to make it digestible.
Yeah, that would be quite helpful, Lori. I ask it from a position of a person who is regularly and talk about and supported the emergency rent assistance. I'm far more challenged in the ongoing rent assistance and where that cutoff exists. And I don't feel like I've got enough real person, real number data instead of whole metric data to help me have that conversation. And then with respect to, I'm taking into kind of Ryan and we mentioned we've had some times where we've dipped. I was here in 2015 when we did the focus on veterans homelessness. Do we spend any money in more affordable communities? Meaning, have we ever bought a piece of land and built a building in a place that's cheaper than it is in Portland? And we have ownership and authority over who gets housed there? Or do we always look in Portland, which I think is the most expensive real estate in the state of Oregon?
I initially was like, I initially did this and I want to just say that was we definitely pay rent assistance in community, but I'm not answering your other question, the building question.
Thanks.
And Director Hisarich will speak to this better, but I would answer your question by saying it depends on who you mean by we and how big that we is.
We Multnomah County, we
yes.
City of Portland.
We Multnomah County, we City of Portland,
And Gotcha.
probably not, but Director Hisarich will give you the better answer. But when you look at regional investments like the Regional Supportive Housing Bond, that was certainly the purpose and intent, is that we could make those investments throughout the region so that they could be regionally serving resources.
Yep. And I think that's something that we need to be driving towards. Because Metro obviously wants to see this truly be a regional program, and there's some realities about where how much it costs to do things in different areas. So I think that this is absolutely one of those.
Mayor brings up a lot that about a third of our homeless population in our community are, quote, from somewhere else. They came to Portland for whatever the reason was. And I wonder, what are the things that are driving them out of their other communities, since we have the ability sometimes to develop housing? Should we be considering developing housing in more affordable markets to help with that situation? And it's a question that I don't know, both philosophically, ethically, and financially, what makes sense in those situations.
Counselor, I do have to jump in though. This 1/3 of people coming from other communities is not accurate data. I think it's really important that you actually see the point in time count data and where we're getting that information from, because this is a narrative that every community in America talks about people coming from somewhere else. And so we actually started collecting that data quite some time ago in this community to answer that question. And so I think it's important that we share that with all city council and all board of commissioners, because that's a talking point I hear a lot in the community, and people don't understand that sometimes when they're not from here, they're from Clackamas or they're from Washington County, but most often people are literally found in the neighborhood that they last had a place to live. And so that piece feels just important to make sure that you've got the accurate data.
Thank you.
Oh, go ahead, Chair.
No, I was going to say, we have a couple folks. So did you want to respond to Councilor Zimmerman?
Yes. Good morning, Helmy Hisarich,
Good morning.
Director at the Portland Housing Bureau.
Thank you for joining.
You share her pronouns, and just in response, we don't build outside of the city of Portland using the funding that is really a local funding source. There are a few outliers where we have funded, well, we certainly fund within Multnomah County because we have partnerships with Gresham, and so we do fund outside of the city, but we really focus primarily our funds locally, and we're not looking for lower cost places to build as a rule. But it's certainly something we could discuss, but I think it's also would be very challenging interjurisdictionally for us to be doing that.
Meaning I can't go buy a piece of property as a government in someone else's government? I think I can.
Legally.
Legally, I think we can do that.
I think, yeah, I don't think legally we can't. I think politically it will be challenging to do that.
That's his job. That's his job.
I love how you.
Yeah.
I challenge their part-time city councilors to do that.
As a director, I've not been advised to do build housing, affordable
I
housing.
appreciate the laughs, but I think in the world of, I've been at this county since 2007. I'm now at the city. I've never seen that trend line that's on the screen right now actually do that. So I'm willing to ask radical and ridiculous questions to get a sense of what the hell. introduced into the situation a little bit.
Mhm.
So I recognize that that could be the quote of the day, that Counselor Zimmerman wants us to buy up affordable housing in other cities. Maybe, but if it gets the pump primed a little bit, on how much rent assistance goes out, what is our level, how many people are going to be on, uh, supported in order to stay housed in our community, and where those lines exist. I mean, I think I'm comfortable with it, and I recognize a little bit of humor, but it probably is needed.
Okay, thank you. Yeah,
Can we move on to 8?
yes, I just want, do we have anything, any questions on this? If we have comments, I want to hold those so that we can get through the material, but any questions?
I just want to respond. The point in time is what I reviewed, and it's called homeless upon arrival or previously housed location. And under the data and the review, it was 26% of the souls were from out of state. There are certainly individuals from Deschutes County, Marion County as well. But regardless of the number, going through our reunification program, we're far exceeding what we thought we would be reunifying with out of state. And so it doesn't matter if they're here and they're held captive on our street, hostage, and we can help them get back home. If it's Tulsa, Orlando yesterday, our job is to help them get back home. So it doesn't matter if it's 100 or if it's 4,000, we have a real goal to help people with housing. So now back to this point, specifically, Ryan, I would say the 20% specifically. And the reason is goal setting is really hard. Good goal setting is really hard. And self-actualization is really important to get the culture changed. Far-reaching yet achievable. If we did 70% and we only achieved 30%, which would be amazing, we would have failed. So I would say 20, just to put it on the table, we got a long ways to go, and I'm not going to overtalk this, I promise. 20%, make it realistic, achievable, celebrate for a day, reset, and move forward again. Do you understand? It's inch stones versus milestones. We can't think in terms of 2028. We need to be thinking in terms of June 30th, 2026. Hit it, move forward, lock it in, move forward. Okay?
All right, thank you. And Anna.
Yeah, thanks. I'll be really brief. I think my question is more around the regional supportive housing bond. And I think I appreciate the note of like, we need that foundational funding floor to understand how to make decisions in July. And I think this was brought up, I want to say several meetings ago, when we had a presentation on just the allocations across jurisdictions in the region. And in particular, I was interested to hear the data point around Clackamas and their funding, given the need per capita over there and how that is very different than here. I'm just curious, like, who makes that decision? Is it Metro? Is it the voters? Is that reallocation like that? Is that discussion happening around identifying those differing needs and allocations?
I think I bring it up every single time I talk to Metro Council or other county commissioners, just because I want them to understand this is a priority for us. And if we want to truly be successful as a region in addressing homelessness, we have to right size where the resources are going to follow the need. And so that is something that we continue to push on. Obviously, that is something that I think all of us can raise up as Metro's going into these conversations about governments and KPIs themselves, is how do we, once we establish those, understand, like, in order to reach the KPIs that are being set, we have to have a different allocation of resources.
Okay, so we're going to have Ryan do a light touch on number 8, which is the unsheltered KPI, and then we're going to kick it over to Director Hisarek, and so many of your questions. You will see answers in her slides.
Great. So KPI number 8 is really helpful just as an illustration for understanding how all of these where we're applying estimates start to click in together. They feed each other in terms of the kinds of outputs or outcomes that you would see associated with one is tied to the other. One is kind of KPI number 1, and the estimates that we built around that are kind of the center of it all. But this will help you understand how that plays out in terms of not just the number of people who are experiencing homelessness, but that percentage of those who are unsheltered. So just by way of setting this up, it's important to understand that this goal was structured as a percentage. I know this is a little pedantic, but I want to just be clear that to get to a percentage, you have both a numerator and a denominator. And so you can affect a goal by either changing the numerator or changing the denominator. So right now, just as a generic example, if you had 1,000 folks who are homeless, 500 who are unsheltered, 50% of those folks, 500 who were sheltered, 50% of those folks would be sheltered. So if you go to the next example, you can affect that on the numerator side. You can take that 500, if you'll go ahead one, you could add 500 shelter beds and go ahead one, then you'd have 1,000 people who are sheltered and 1,000 people who are homeless. So 100% of folks who were homeless would be sheltered. Or if you go to the next example, you can address it through the denominator. So if you took 1,000 of those folks who are homeless and housed 500 of them, now you would be in a situation where you had 500 who are in shelter, 500 who are homeless, and you'd be at 100%. So I put that forward to illustrate both some of the choices and the conversations that Mayor Wilson has talked about that are coming into the budget discussions, because you will be making the legislative bodies and setting budgets choices about how much are you investing in the numerators versus the denominators, but also to illustrate that as we modeled this out, we were looking just at the denominator effects. So greater, by housing more people, you're reducing the total number of people who are homeless in general, and that will impact the percentage of who's unsheltered. We didn't look at these in these estimates at adding adding a bunch of additional shelter beds would do, just for purposes of illustration. So if you go to the next slide, this is how goal scenario 1 and goal scenario 2, as we outlined them in KPI number 1, play out relative to this KPI. So if you were to look at that 20% overall reduction scenario, you would be shifting from approximately 48% now of the population who is unsheltered in any given month to approximately 41% of the population being unsheltered. If you were moving with that more aggressive, but very likely highly unrealistic goal scenario 2, where you saw a 70% reduction, that's where you could actually get to having enough shelter beds in our existing system to be able to shelter every person who is experiencing homelessness during that month. So that's how those sets of scenarios play through these different goals. I wanted to hold it forward mainly as an illustration. And I think the instruction is to skip so I'll just briefly notate on the next slides rather than talking you through them. Let's do talk about 8, but let me just speak to these really quick and then we'll loop back if that's okay. So in a similar way, those goal scenarios 1 and 2 play out through multiple other KPIs. So you'll see in these next 2 slides, and I'm not going to describe them. They're outlined in your document there. We'll make the slides available to you, but you can see how those goal scenarios play out relative to some of these other KPIs, particularly around the number of people who leave homelessness and the number who leave specifically to housing. So there you go. Sorry. I will turn it back and then.
So let's hold on. Let's go through, because I know we wanted to delve into 3 more. So let's go through these, go through 3, and then we'll come back to have a
And
conversation.
we only have 15 minutes.
Yeah.
It's actually 11:15 that everybody has to go.
That was my fault. I had the wrong end time.
I would love, are y'all opposed to letting Helmi go? Because so much of your earlier questions were about her slides. I at least want you to lay eyes on them.
Yes, let's do that. And then we'll go back for questions for folks.
Thank you. Thank you. I will go through this quickly. I have 4 slides to share with you. And this is regarding, weird background on the slide. Okay, so this is just to provide some context. I first of all want to share with you that we're using the data set that we're using here is a little bit, it's it's actually old. It's 2017 to 2021 data, but it's the best source of data we have to provide a very big picture context. And we're going to start really talking at a high level, and I'm going to work down to much more near-term goals so that we can see both the big system and the immediate next steps. So first of all, just understanding the data that we have is called CHAS data, Comprehensive Housing Affordability Data, that is coming from HUD. This covers both affordable and market rate housing, or I should say it doesn't distinguish between regulated and non-regulated housing. But what we did do is provide the renter data. And the reason we're focusing on renters is because renters in Portland, their area median income, or the average income, is half of what the income is of homeowners. So the vast majority of people that are moving into the homelessness are actually folks that are currently renting that are highly rent stressed. So we're going to focus in on that population. So within the city of Portland, the renter population, what you can see is that 24% of the households in Portland are extremely low income. And those are households earning 0 to 30% of the area median. And I'm going to share with you the incomes on the next slide. About 34% of the population is either very low or low income. So all of those folks are who we serve through the affordable housing, regulated affordable housing system. And what you should also know is that there are, with the total renter households, there are 130,000 households in the city. About 31,000 of those households are extremely low income. There are about 35,000 households that are paying more than half their income on rent. So those are called rent burdened, extremely rent burdened. And it's the extremely rent burdened population that is most susceptible or vulnerable to displacement into homelessness. So I'm sorry, it's 35,000. So the 24% of extremely low income represents 31,000 households. They're not all of those extremely low incomes are stressed. Not all of them are, but many of them are. The total rent stressed population cuts across the extremely low, very low, and low income populations, with 35,000 households experiencing that. The vast majority of folks that are likely to be displaced into homelessness are going to come from extremely low income, highly rent stressed populations. Okay, the next slide, I'm going to walk through the income so you understand. This goes to the question of who is rent. I think you asked earlier, what do these categories mean? So when the first category of 0 to 30% of AMI is area median income, that is the extremely low income population. A typical extremely low income householder in Portland could be a couple living off of Social Security, earning an annual income of $15,000, $800, and their affordable rent is about $395. So if they were not stressed, they would pay $395 a month in their rent, and they could survive comfortably here in Portland. An individual householder, a single person on disability, would be earning about $10,500 a year, and they could afford a rent that's below $300 a month. So that gives you a sense of the 24% of people that are extremely low income are in that category. And the fastest growing number of people are seniors that are moving into this category, who are moving into living on their Social Security. The next category, 31 to 60% of the area median, are very low income households. We call that very low income. That's the nomenclature in the affordable housing community. Those are households earning a typical, school teacher earning about $37,800 a year. They can afford a rent of about just under $1,000 a month, $945 a month.
Can we move a little bit faster, my love?
Yeah, okay. I'll get through this really fast. I won't talk about low income but I just want to point these rents out because these are where the folks that are homeless are coming from. These are where the folks that are most stressed. The median rents in Portland are around $1,200 a month. And so what you can see is that folks that are extremely low income and low income, there's not a lot of housing supply for them.
I just want to acknowledge, these are all couples or singles. We're not accounting for families here.
This was really not accounting. This was just, yeah, this is for.
That's fine. I just think, I do want to just note, we need to
Thank
talk about families because I do think that's another part of the challenge is we assume affordability at a level that they can't afford.
Right. I think that's a really important point. And yeah, it's just for examples, but we should have probably added a family across all income segments. Okay, the next slide I think is probably the more important one. Those were just to give you some context. What we know looking at the CHAZ data is that in the city of Portland, we have about 30,690 households that are extremely low income, and we have about 11,740 units, affordable units. This is both regulated and non-regulated. So this is the full market. We have a deficit of close to 19,000 units in this category. So the extremely low income population has very little has extreme limited housing supply. It's probably where the biggest deficits lie. As you move up the income scale, you see that we actually have a surplus at some income ranges. So when you're hitting about 60% of the median, we actually have quite a lot of housing in that category. So we see vacancies in our quote affordable housing sector, but we don't have, but they're not available. They're not units that this population can afford. So two conditions are occurring. One is that people are going into affordable housing and paying way too much of their income and facing displacement. There's actually a consequence of folks that just can't afford even in the regulated households. They're going into housing that's too high income. Secondly, we see instability in the marketplace for the 60% of AMI units. So we see housing providers having a hard time filling those units because the demand and the supply are not working. It's a market system that's not working. Next slide. So this is the metric that we're using is the percentage of, or the number of housing units per 100 extremely low income households. So this is just an explanation of the calculation that we've used in this KPI. And it's, showing you, we're basically taking on the numerator, the number of affordable housing units divided by the extremely low income households. So how many units, how many households times 100, that gets us to, we have 38.25 affordable housing units per 100 extremely low income households. So a lot of competition. If you're in that 100, sometimes people say musical chairs is the example. There's 38 chairs, 100 people trying to get into them. Okay. Let's go to the next slide. Next slide. Thank you. So this is just a summary of, how we might think of this indicator. So first of all, this indicator is not, I wouldn't say this is a very, very high level performance indicator that we have very little direct control over because many things are factoring into it. But what it does give us is some targets, some ways to think about housing targets. In a perfect world, we would have one unit for every extremely low income household. So we would have 18,000 or almost 19,000 more units that are at rents below $500 a month. So that would be sort of perfect world. We have 19,000 units. That would get us at a 1-to-1 number. If we wanted to set a target, a more near-term target of, say, we wanted to achieve 45 units per 100 people, that would get us to a net new needed supply of 2,000 units, or not new, I would say a target that we could shoot for in the next, 18 months, 12 to 18 months. So setting up, if we were to just say, we want this indicator to go up, and we want to set a target of trying to get to 45 units per 100 extremely low income households, we would add 2,000 extremely low income units. There are the sub indicators that I've put on the table are things we are actively working on right now One is working with the mayor on home share, opening up bedrooms, setting a clear target of getting at least 600 bedrooms opened up for extremely low income households at rents that are closer to $300 a month. Buying down rents in the existing affordable housing supply. So what we really want to do is focus on looking at the current housing supply that we've just funded through the bond program and try to press down on the rents for those. The more we press down on those rents through a capital strategy or a refinancing strategy, the less we need to rely on rents supports. So we see an opportunity right now because we've just put a lot of this into the development system, and we think there's some opportunities to create some deeper affordability. And then finally, targeting new construction. I should have put new construction or acquisition of new units at that are of 500 new units, that would be targeting a 30% of AMI. So these are sort of near-term ways for us to approach that big KPI. And there's more things we can be doing. I think the work we're doing around social housing and new opportunities for how we finance could help us also achieve a better supply of deeply affordable housing relative to market demand.
Thank you.
Thank you.
That's very good.
Very good. All right.
All right, we have 5 minutes, y'all. My hopes and dreams aren't going to come true.
Oh, yeah.
Are they?
They are.
Okay. Didn't think so. What do y'all need? Do you need to go away and read and digest this document, and then we can have individual conversations or via email and eventually a vote via email? Or do you need more time from Director Hisarek, Ryan, and Lori? Do we need another meeting, which would need to happen before November 13th? What y'all need?
I mean, right.
To read and digest, and then maybe a virtual meeting. I don't know.
Yeah.
How are people feel?
So I'm leaning towards the second option. Have some time to digest this. If there are questions, because I know we didn't get a chance to get to all the questions in this second section, and I think that's really important. Have time for folks to reach out to you to get those questions answered, and then come together before the joint session to see if we can get the consensus on a recommendation to refer these to the city and county boards.
I would just add that I'm interested in seeing responses to everybody's questions because that also helps me think through things that I might not have asked.
So when we come back virtually, we can actually probably go through some of those questions too and share them ahead of time. Okay.
Councilor Zimmerman, is that still valid?
Yeah, I mean, if we were voting today, I'd be a 3, right?
Yeah,
So I get a lot from this conversation.
Mhm.
My staff and I have already done the deep dive on these, but then it gets filled out by different levels of experience. So I actually value this a hell of a lot more than I value email communications with you guys for clarification. That's not what I'm interested in. I'm more interested in the discussion and a little bit of debate.
Okay.
That's where I would be helpful. So I can make myself available if we need to come together again.
Are you good with virtual? Save everybody some time. It's very hard to schedule, y'all, but if you give me some authority over your schedulers,
I mean,
make it happen.
if I'm gonna sit 2 hours in a room or 2 hours in my office, it's still 2 hours. So I guess I don't get as fruitful of a conversation virtually. And I think that this should be done in person. And if it's the same commitment of time, that would be my preference.
Okay.
Mayor, was that up for a reason? Your little name tag?
I think that was left over.
Okay.
Okay. Okay. So I think we have some time. I mean, I think we have some direction now. So we're gonna, so please, folks, if you have questions that haven't been answered, please share them with staff so they can start preparing those answers for us. We will look before the November date to get us back together, preferably in person. And then we'll look towards then, continuing to have conversation with the broader board and council at the joint session.
Okay.
Okay. All right. Thank you, everyone. Appreciate the really good work today. Thank you, staff, for all of the prep on this. It was a very broad conversation. So it says our next meeting is going to be in December, but we know that's not the case anymore. So thanks again for your time, and we will see everyone soon.
Thank you. Thank you.
I have hard copies. One that was on the screen actually was not the latest version, so my fault, not yours. Okay, great. Okay, great. I'll leave these here.
Okay, thank you.